Actually, many times, when you make a Facebook Live for both the common public and for the doctors at the same time, it's actually very difficult to keep justice for both groups. Can you close that door? So, this is why I wanted to do a Facebook Live just for the doctors. And the relevance of the topic, migraine, which is very common during this time, which is the peak summer time in UAE. Actually, I had some notes prepared for migraine headache for one of my presentation in May in 2016-17. So it was easy for me to brush up those topics. And those doctors, who are online with me, if you can keep, some of your books like the Sutrasthanam or Uttarasthanam or the Chikilsasthanam with you, it would be easy for us to refer in between if you have any doubts. And if you have any questions, please shoot by text. I will reply to all those, by the end of the talk within my knowledge limits. We know that many people, we use the term migraine to describe any type of severe headache. However, all the headaches are not migraines. Actually, migraine constitutes only 16% of the primary headaches. So the remaining 84% of the primary headaches are not migraine headaches. At the same time, the migraine headaches are so wide patterned. Therefore, it is often misdiagnosed as a tension headache or as a sinus headache, or sometimes, even vertigo symptoms are misdiagnosed as migraine headaches. In an Ayurvedic clinic, we might see there are two types of migraine patients. One, you are the primary physician, and with the aid of the symptom criteria and through the investigation rule out, you have diagnosed a headache case as migraine. Secondly, a previously diagnosed migraine patient, and some patients even come to you with a pre-diagnosis or a self-diagnosis that I have migraine and I need a Shirodhara treatment. Actually, our Ayurvedic books describe Shirashula or headache as a symptom of various diseases, but at the same time as an independent disease entity. We might now get confused. The migraine patient or the migraine case, which is sitting in front of us in the patient chair, whether it is a case of Vatabhidhava or an Ardhavabehdaka or a Pittabhidhava or a Kaphabhidhava or a Suryavarta or an Aanata Vata, or is it another disease? Now, the doctor is about to get a visit from the migraine fairy, getting confused between all these terminologies. If it is to make a prescription of Varanadi kashayam or Dasmamoola kaduthrayam, there is no point of a pinpoint diagnosis as migraine differentiating from a sinus headache or migraine differentiating from a tension headache. And there is no need of correlating an Ardhavabehdaka or Aanata Vata with migraine if your prescription is going to be the same Varanadi kashayam and Sirisoolari gulika. So let's explore migraine through a magnifying glass of Ayurveda, and let's try to treat migraine in a better way through the Ayurvedic principles. We have studied, in the Sutrasthanam that Vigaranama agushalo na jihriyat kadajanaha nahi sarva vigaranam namato asti thruvasthiti. The physician should never feel shy for not knowing the name of the disease, for there is no rule that every disease has a name. However, our Acharya Vagbhada says a condition there. He says, Saeva kupido doshaha samuthana visheshadaha sthanantarani cha prapya vigaran kurade bahun tasmat vigara prakriti athishtantarani cha buddhva hedu visheshamscha shikram kuryadupakramam. So, we should know the vigara prakriti, athishtanam, hedu vishesha, all these should be known, though we do not know the name of the disease. So, we should know the disease pathology, we should know the dosha involvement, we should know the vikara prakriti, we should know the athishtanam, and we should know the hedu vishesha before treating any disease. So, let's find out, which dosha is playing a role in a case of migraine headache. And we know that the migraine symptoms can be grouped into 4 stages, which is the prodrome phase, the aura phase, the attack phase, and the postdrome phase. So, when we are going through the different phases, the prodrome or the aura or the attack phase or the postdrome stages, keep it in mind in the first stages, keep it in mind the vritti lakshanas of the doshas or the chaya lakshanas of the doshas. And we studied that in the Nidana Sthanam in the Sutra Sthanam, that the chaya lakshanas of Vata as Karsya, Kashnya, Gatragamba, Spurana, Ushnagamida, Sapnya Nidranasham, Belaindriya Upakhada, Astishulam, Majashosham, Malasangam, Atmanam, Adopam, Moha, Dainya, Bhaya, Shoga, Pralabadibhar, Virthovayu Pederi. And the Pitta Chaya Lakshanas, we studied as Pidatvaglani, Indriya Daurvalyam, Ojo Visramsam, Shida Pilasha, Daha Tiktasyada, Trinmurcha, Alpanidrada, Pitta. So keep these chaya lakshanas in mind while we are going through the prodrome phase of migraine. The prodrome phase of the migraine, it is usually seen 1 to 2 days before the migraine starts. The symptoms like constipation, we know that it is a Vata symptom. Mood changes, a Vata symptom. Food craving, it can be Vata or Pitta symptom. Neck stiffness, Vata. Increased thirst or increased urination, Vata, or it can be Pitta. Frequent yawning, Vata symptom. So you can see that in the prodrome phase, the symptoms are mostly about the chaya lakshanas of Vata or Pitta. Now let's see the aura symptoms. Aura symptoms are not seen in all the migraine cases, but only in 20% of the migraine conditions. And the aura phase usually lasts for 20 to 60 minutes before a migraine attack. The symptoms, aura symptoms, like you take the visual phenomena of bright spots or flashes of light, it's a Pitta symptom. Temporary loss of vision, it can be Vata or a Pitta symptom. Pins and needle sensation on the arm or on the leg, a Vata symptom. Weakness, numbness on the face or on the half of the body, Vata. Speech difficulty, Vata. Tinnitus, Vata. Uncontrollable jerking or the other movements. Limb weakness or which is seen in the hemiplegic migraine, again a Vata symptom. So in the prodrome phase and in the aura symptom, we can see that Vata Pitta are surely the dominant doshas there. And keep it in mind, the Koba Lakshana of Vata and Pitta. So I was talking about the Chaya Lakshanas previously. Now think about the Koba Lakshanas of Vata and Pitta while going through the migraine symptoms and through the postdrome symptoms. So we studied again Vata Koba Lakshanas like Sramsa, Vyasa, Sanga, Sada, Pheda, Toda, Harsha, Varta, Angamarda, Kamba, Vyatha, Veshta, Swapa, Barushya. So all these different types of Vedana Visheshas are seen in cases of Vata Kopa. And for the Pitta Kopa, we have studied that Daha, Ushma Paga, Sweda, Kleda, Kotha, Srava, Ragaha, Kadvamla Lavana Rasatvam. So these are the Kopa Lakshanas of Pitta. So keep this in mind when we are going through the symptoms of migraine. Now, sometimes, we might see the pain on unilateral headache, pain on one side of the head, which we call it like Ardhavabehdaka kind of symptoms. It is a Vadika symptom. The pain that feels throbbing or pulsing in nature, Vada symptom. Sensitivity to light, sound, smell, touch, Pitta or Vada symptom. Nausea and vomiting, blurred vision, lightheadedness followed by fainting. So when you see all these symptoms, you can see that again they are the Kopa Lakshanas of Vata and Pitta. Now look at the postdrome phase again. The postdrome phase is usually seen like 24 hours after the migraine attack. So symptoms like confusion, moodiness, dizziness, weakness, sensitivity to light and sound, these are all again coming to the spectrum of Vata, Pitta, Prakopa Lakshanas. So sometimes, you might doubt. See, 45% of the migraine patients, they report sinus symptoms like lacrimation, nasal congestion, rhinorrhea, rhinitis, exudation, etc. But keep it in mind that kleda, that is maybe the inflammation with moistness, or sruti, inflammation with exudation. Sweda, kleda, kotha, srava, ragaha, these are clearly pitta symptoms rather than just a kapha symptom. So, according to me, the kapha vritti and kapha kopa lakshanas are not seen as a symptom of migraine. So, again, you might say that, again there are kapha symptoms. But keep it in mind that the sama lakshanas of the doshas, that is, the srodorotha, balabhramcha, gaurava, anilamudhata, alasyam abhakti nishtivaha, malasanga arujiklamaha, lingam malanam samana. Right? So these sama lakshanas of the doshas, like this srodorotham, balabhramcham, gauravam, anilamudhata, etc., shouldn't be confused with the kapha symptoms. They can be the sama lakshanas of Vata or Pitta. Now, let's explore the etiology. So, we know the dosha hedu and the vyadhi hedu already. We have studied, in the Nidhanasthana that the kopa karanas of Vata as tiktoshana kashaya alparusha pramida pojanehi vega udirana dharana nishajagara atyucha bhashanehi Kriya adi yoga bhishoga chinda vyayama maitunehi grishma ahauratri puktande pragupyadi samiranaha. And we have studied the pitta gopakaranas like pittam kadvamla tishnoshna padu krodha vidahibihi charan matyana ratrartha vidaha sameshuja. So keep this in mind. The Vata Kopa Karanas, Vata Kopa Nidanas and Pitta Kopa Nidanas, and while exploring through the etiology of migraine. And the Vyadhi Hedu, we have already studied in the Uttarasthana, in the Shiroroga Vijnaniya. We studied that Thumadapa Tusharambu Krida Adiswapna Jagarehi Utsveda Ati Purovada Bashpa Nigraharodanehi Atyambu Madhyapanena Krimibhir Vegathaраnehi Upadhanamrich Abhyangadvesha Adha Pradateshanehi Asatmyagandha Dushtama Pashyadhyesya Shirogadaha Janayandyamayan Doshan. So I'm not translating, the Sanskrit, the slokas, since I'm expecting that, most of you are Ayurvedic practitioners. And when you are going through the dosha hedu and when you are going through the vyadhi hedu, you can see some ubhaya hedus here. The ubhaya hedus which we can see clearly are, one is the Vegarotha. Vegarotha of the Vegas like Shakrit, Mutra, Shud or hunger or the sleep, and Shoga is also seen as an Upaya Hedu in coming across in both the Dosha Hedu and the Vyati Hedu. Now, going a bit further deep, which dosha, right? Of course, we know that pranavada is Murthanyavasthidaha, Kandorasaro, Buddhindriya Hridaya Manodhamani Dharanam, Stevanam, Shavatu, Udgaram, all these functions are done by the pranavada. And Alojaka Pitta is also in the head region. Drishtistam, Rupa Alochanat, Alojagat, Alojaka. Right? And if you want to consider, even the Kapha dosha, of course, Tarpaga Kapha is there. Shirastham, Chashurad Indriya Tarpanal, Tarpaga. So, the three doshas, one is Pranavada and Alojaka Pitta and maybe Tarpaga Kapha if you want to argue that Kapha also plays a role there. Now, let's go to the sthana. So, where is this Vyadhi manifested? It is, of course, Shiras itself. And Shiras is which dosha sthana? Is it a Vada sthana? Vada sthana we studied as Pakvashayam, Kadi Saktini, Padavasti, Srotram, Sparsanam cha Vada sthanani. So Shiras is not coming here. So it is not a Vada sthana. Nabhi Ramashiyo, Svedo Lasiga Ruthiram, Chashuhu, Pitta sthanani. Is it a Pitta sthana? No. Shiras is not coming there. But it is a Kapha sthana. It says Ura, Kantha, Shira, Kloma, Parvanyamashyo, Raso, Medo, Kranam, Rasanam cha. So it is obviously a Kapasthana. So we have understood that the Agandu dosha here is Vadapittam and the Sthani dosham is Kapha. And we also studied that Pittam Pangu, Kapham Pangu, Pangavo Maladhadavaha, Vayuna Yatra Niryande Tatra Gachadi Mekhavat. So that means the Pitta, it is carried by the Vada to the seat of Kapha and producing the problem. So the picture is a bit more clearer now. The Vada and Pitta have vitiated and they have located in the Kapasthana, causing my patient's headache who is sitting in front of us. See, so much of thinking a practitioner might have to do while consulting with a patient. So, Rogasthana here is the Shiras, which is the Kapasthana. It is the Mahamarma, and also keep it in mind that it is the Madhyama Roga Marga. So, the characteristics of nature of migraine, it is the remissions and relapses or the Vishamada of the condition. So, being migraine a Vata dominant condition, Vishamada is inherent to the disease. In the disease pathology, the doshas move from Koshta to the Shakha due to the causes like Vyayamad, Ushmanad, Taishnyad, Ahidajaranadabi. So, because of the reasons and due to the etiological factors, the doshas move from Koshta to the Shakha and produce the migraine headache. And it manifests as the symptoms. Once the Vada Pitta moves from Shakha back to the Koshta after a migraine attack, probably by the effect of Srodhomukha Vishodhanam, Vritti, Abhishyandanam, Pagam, Vayosya Nigraham, then the doshas remain in the Koshta waiting for another exciting factor to go back to the Shakha and to produce the disease. And after deriving strength by season, time, etc., they further get aggravated and move to the same Shakha or maybe to the same Astisanti or to the other places as well, and they produce the disease depending on the condition. Now, the triggers which can make the headache worse, like alcohol changes, weather changes, lack of sleep, schedule changes, dehydration, hunger, certain food items, strong smells, teeth grinding at night, menstruation, etc. These are all considered as the triggering factors for migraine. Which dosha unbalancing all these factors? Of course, they are all Vata Pitta provoking factors. And the same theory of the Vishamada is mentioned in the Jura Prakaranam also by the Vagbhada. It says, Vagbhada says, Krishanam Vyati Muktanam Mithyaharadi Sevina Alpovi dosho dushyader labdva anyata madobalam savilaksho jwaram kuryat vishamam shayavratibhak. So, again in the Jwara Prakarana, the probability of the Vishamada is mentioning here. After the remissions and relapses of migraine, it can be explained, with the Vishamajara concept too, that is based on the Dhadu Lina Avastha causing the Vishamada. And Vakpada continues in the Jwara Prakaranam, Dosha Pravartade Tesham Swekale Jurayan Beli Nivartade Punaschesha Pratyaniga Balabalaha Shine Dosho Jwaraha Sushmo Rasadishu Avaliyade. So, Linata is explained here. Linatvat Karsya Vaivarnya Jalyadi Nadadadisa. So, that means when the dosha becomes weak, they immerse into the dhadu and causing Karsya, Vaivarnya, Jalya, etc. So, clearly explaining the Dhadu Linada concept in the Jwara Prakarana. So, the concept of Jwara, so since we were talking about the Jwara, let's explore, how we can bring in the concept of Jwara in the context of migraine headache. So, go to the symptoms of Vada Jwara Lakshanas. In the Vada Jwara Lakshanas, Acharya says, Nistoda Shankhayor Murthni Vedana Virasasyada. See, headache is mentioned as a symptom of Vadiga Jwara. Nistoda Shankhayor Murthni Vedana. So, not only in Vadiga Jwara, go to Vada Pitta Jwara. Shiro Arti Murcha Vamidaha Moha. Kandha Asya Shosha Aradi Parvabhedaha. Unnidrada Tritprama Romaharsha Jrambhadi Vaktvamcha Chalal Sapittat. Shiro Arti, Murcha, these are all the symptoms clearly mentioned, as a symptom of Vada Pitta Jwara. So, most of the migraine symptoms are out here as a symptom of Vada Pitta Jwara as symptoms. Now, if you want to argue that, no, I would like to treat it as a Vada Kapha Jwara, right? Of course, again, in Vada Kapha Jwara Lakshanas, the symptoms are mentioned as Tabahani, Aruchi, Parva, Shiroruk. Again, Shiroruk is mentioned as a symptom of Vada Kapha Jwara. And not only there, if you go to Vishama Jwara, in the Tritiyaga Jwara, again, headache is mentioned. Tridiyage, that is Grahi Pitta Analat Murthni Trigasya Kapha Pittadaha. So, Triga pain is seen in when it is Kapha Pitta dominant, and the Murthni Vedana is seen when it is Pitta Anila dominant. So, in my perspective, it is Vada Pitta, and the Vishamada is inherent to nature, and the Vishamada of the migraine can be explained based on the Shakha Koshtagadi or based on the Jwara Samprapti, which is mentioned by the Vakpada, Vishamajara concept. Now, we need to understand, what is the Dosha Avastha, because Vakpada says, though we need not to know the name of the disease, all these factors, the etiology, the dosha avastha, all these need to be understood. See, when more pitta symptoms are seen in a migraine case, we can suspect the possibility of avarana by the pitta. And avaraga dosha is more vitiated than the avrada dosha in an avarana condition. So, if it is pittam is causing an avaranam to vada, that is a possibility of doshavastha. Because the pitta has to interact with the different types of vada to carry out their different functions. For example, Pachaka pitta works together with samana vada, or Alojaka pitta works together with prana vada, and they function like a single unit in case of digestion, or let it be in the case of vision. When such interactions affect the normal pathway of any type of vada, it can lead to an avarana condition. And go to again Nidanasthana, Pittavrada Vada Lakshanas. Lingam Pittavrade, Daham Trishna Shulam Prama Tama Kadukoshna Amla Lavanair Vidaha. Again, there are similar symptoms are there. And migraine symptoms are sometimes, very similar to the Pittavrata Prana Lakshanas also. Pramo Murcha Rujadaha Pittena Pranavrade Vidakte Annecha Vamana. Again, nausea symptoms are all seen in Pittavrata Prana Lakshanas. According to me, Kaphavarana Lakshanas are not seen in the migraine headaches. Kaphavrata Vada Lakshanas mentioned as Sleshmanatu Avrade Prane Sadam Tandra Arujirvami Stivana Shavatu Udgara. These are the symptoms mentioned in the Kaphavrata Pranavada Lakshanas. So kindly, keep the textbook beside with you. If you have any doubts, just go through once again. So the differential diagnosis of the dosha involvement here, it can be a Kevala Vada or it can be a Vada Kopa with Pittanubandha, or it can be a Pittavrata Vada. See, the same way the modern medicine is doing the differential diagnosis, in the context of just the dosha avastha, we can do a differential diagnosis. It can be a Kevala Vadika condition, it can be a Vada Kopa with Pitta Anubandha, or it can be a Pittavrata Vada or Pittavrata Pranavada Lakshanas. So this exclusion by Nidana, Lakshana, Upashaya, all these can be done to differentiate whether it is a Kevala Vada condition or whether it is an Avarana condition. Now, coming, again from the Doshavastha, am I taking too much time? Coming again to the Samprapti of the disease. So, we have understood that the dosha here is Vada or Vada Pitta. Dosha Avastha is Thadu Gada Avastha or the Thadu Lina Avastha. Rogasthanam is Chiras, which is the Kapasthana, which is the Mahamarma, which is the Madhyama Roga Marga. The Dosha Hedu is the causative factors of Vada Pitta Kopa. The Vyati Hedu, as mentioned in the Shiroroga Vijnaniya Madhyaya. Ubhaya Hedu, Vegatharanas of Shakarat, Mutra, Nidra, etc. And the disease similarities, Ardhavabehdaka, which is the migraine with unilateral pattern with relapses, or it can be Vishamajvara, the migraine with remissions and relapses. Pitta Shirashula, migraine with aura symptoms mostly, or it can be a Vada Pitta Jvara, migraine symptoms with aura mostly, or it can be a Vada Jvara, migraine with relapses, or it can be a Pittavrata Prana, which is the migraine symptoms with aura mostly. So these are all the similarities of the diseases. But keep it in mind that we need to differentiate this condition from a Vadika Shirashula, which is mostly of the tension headache patterns. And we also need to differentiate a migraine headache from a Kapha Shirashula, which is mostly of the sinusitis related headaches. Now, let's go to the treatment protocol also quickly. Coming to the treatment, it is completely, the physician's liberty to treat. I will treat it as an Ardhavabehdaka, I will treat it as a Suryavarta or as a Pittavrata Pranavada, as long as we target the right Nidana Panchaka and as long as we target the right Samprapti Vikadana, it is okay. You can name the disease as Ardhavabehdaka or Suryavarta. But keep in mind, few of the basic principles. Tatra Anyasthana Samsteshu Tadiyam Abaleshu tu Kuryat Sigalsam Swameva Belena Anyabhibhavishu. Priority should be given to the stronger dosha. And another context, Agandum Shamaye Dosham Sthaninam Pratikartyava. So, priority should be given to the Sthaniga dosha than the Agandu dosha. So, keep it in mind that here the Sthani dosha is Kapham, the Agandu dosha is Vada Pitta. Now, let's do an example like, I'm going to treat it like a Vada Pitta Jvara, for example. So, the Kapha provocation should be protected while treating for a Vada Pitta condition, while Shiras is a Kaphasthana. So, the importance is to sense the dosha stage, and to break the samprapti. So as I mentioned, let me show you an example how we can treat migraine based on the principle of a Vata Pitta Jvara. So the guideline here is Lankhanam Swedanam Kalo Yavagus Tiktagorasaha Malanam Pajanani Siho. So here mandam or peya with laja can be given, and in the mandam or peya dadimam or honey can be added. And we studied in the Sutrasthanam the gunam of laja, that is laja trid chardyatisara meha meda kapasidaha kasa pittopashamana deepano lakhavaha hemaha. So in the initial phase, thinking a samavastha, I'm gonna use amapajanam, deepanam, pajanam as the treatment principles. And we studied that the mandam is Vadanulomana. Mando Vadanulomanaha, Tridglani dosha sheshaknaha, Pajano Thadu Samyagrat, Srodo Mardavagrat, and it is Swedi. And there are specific mandas, which are mentioned here. It says, Vasti Parshva Shirashuli Vyakri Gokshura Sathida. Vasti Parshva Shirashuli Vyakri Gokshura Sathida. So it can be used as a mandam. And keep it in mind that the patient has to be hydrated well. Though he has to be hydrated well, you may avoid hot water or warm water for hydration. Why? Acharya Vakpada says, Ushnamevam gunatve api yunjyat na eganda pittale udrikta pitte davatu daha moha adisarini. When the pitta symptoms are predominant, one should not use ushna jala, though it is deepanam, pajanam, khandyam, lagushnam vasti shodhanam. Though ushna jala is having all these properties, ushna jala shouldn't be used in a pitta dominant conditions. So in the initial phase, what kinds of medicine can we give? Drugs of choice, there are several things. You might ask, if you are treating as a Jvara condition, in the Navajvara condition, how can you give medicines? So again, no need to wait for 6 days of Lankhana before starting the medication. Vakpada is very clear. Mrudurjvaro lekhurdeha chalidasya malayadaha Achira jurasyabi bheshajam kareyatadaha. So, bheshajam can be given when the jvara becomes mrudu and the deham become lekhu, and when the doshas are moving, you can start the medicine at that stage itself. So, let's explore few medicines which we can give. Think of Patyashadangam or Patyakshadathriyadi kashayam. Patyakshadathriyadi is mostly, according to me, it's most of Tridoshahara in nature, and mainly Kapha Pittahara in nature. Look at the Palasruti of Patyakshadathriyadi. Patyakshadhatri Poonimba Nishanimba Amrita Yudehi Kradaha Kwadaha Shadango Ayam Sa Gudaha. It says, Sharkara has to be added. Shirsha Shulanut Prushankha Karna Shulani Tatha Artha Shirasorujam Suryavartam Shankagamcha Dandapadam cha Tadrujam Naktantyam Padalam Shuklam Chashu Pidam Yabauhadi. It's an ideal choice. Patyakshadathriyadi kashayam in the initial phase, though it is Kaphapitta Shamana, I'm thinking of this Thani dosha, which is the Kapha. And we can, you don't like Patyakshadathriyadi. There are several other choices. You may give Amrutotharam kashayam. Amrutotharam kashayam is also Tridosha Shamanam, which is mostly Vata Kapha Shamana in nature. And Guluchiyadi kashayam is Kapha Pitta Shamana in nature. Sudarsanam Gulika can be given. Kirada Tiktagam or Poonimba Guluji Mustanagaram can be given in the initial phase. And if you think, you don't want to treat it as you don't like the concept of Vada Pitta, you want to treat it as a Vada Kapajvara. If Vada Kapajvara symptoms are seen, you may give Vyakhyadi kashayam instead of the Amrutotharam kashayam and the Patyakshadathriyadi kashayam. So in the Vyakhyadi kashayam it says Vyakri Shundi Amradakwadaha Pippali Jurna Samyudaha. It's mentioned in the Vata Kapha Jwara. So, or if you want to treat it with Ayurveda kashayam, you have all the freedom. Ayurveda kashayam is also mentioned in the Jwara Prakarana. Ayurveda sa Shaudraha. But keep it in mind that Ayurveda kashayam is mostly Kapha Pitta Shamana. So, once the Ama Pajana is achieved, or once, yes, I will talk about the menstrual migraine also. Once the Sthani dosha is taken care, the stage 2 can be given, which is based on the dosha shamana, or which is based on the Vata Pitta Shamana. So I'm trying to stage this into few. In the first stages, keep it in mind, the concept of Ama or the Sama doshas there. The stage 2 can be started as the dosha shamana or the Vata Pitta Shamana. And what is the treatment principle for Vata Pitta Shamana? We studied that Graishma Prayo Marutpitte. So the summer regimen is the brief protocol for the Vata Pitta Shamana. So very easy, because in the summer regimen, Kapha decreases, Vata increases. Tishnamshu Adidishnamshu. Grishme Samshibadi Ivayat Pratyaham Shiyade Sleshma Tena Vayusya Varthade. Vata is increasing. And it says, Ayurveda says, Ado Asmin Padu Kadu Amla Vyayama Arkagaram Teje. So one should use or avoid using the salty, pungent, sour and heavy physical exertion and exposure to the sunlight as a treatment principle for migraine also. So, Bhajit Mathuram Eva Annam. One may favor Lekusniktham Himam Dravam. That is what Vakpada says as a summer regimen. So one should favor sweet taste, one should favor light, cold, watery and sniktha kind of food. So in the stage 2, you may think of several other drugs, because the objective is to balance Vata Pitta. So think of Vidaryadi Kashayam, Vata Pitta Shamanam, Mridvegadi Kashayam, which is mentioned in the Madatyam, or Drakshadi Kashayam, which is mentioned in the Jwara Prakaranam, which is Pitta Vata Shamana. Kalyanagam Kashayam, which is Tradosha Shamanam in nature. Mahadiktagam Kashayam may be given if Pitta symptoms are more, or Tiktagam Kashayam may be given if Pitta symptoms are 4. So this is the stage 2 which I am proposing. Now the stage 3. Stage 3 is ideal for ghee intake. So when should we give the ghee? As for Vakpada, it says Kashaya Pana Pathyannayar Dashahe iti lankhide sarpirdadyat. Kashaya Pana Pathyannayar Dashahe iti lankhide sarpirdadyat. When should we give it? Kaphe mande Vada Pittotare Jware. So we have previously in the stage 1, we have ensured that the kapha is manda and the disease has become a Vada Pitta condition. Now it is the right time. Pakveshu dosheshu amrudam vishobhamamanyatha. If it is in the right stage, we are placing the ghee, it is as good as amrit. Or if it is in the other stage, it is vishobhamam. So look at, the options of ghees, we have available. It can be Vidaryadi Kridam, or Mahagalyanagam Kridam, or Kalyanagam Kridam, or Brahmi Kridam, or Vrisha Kridam, which is mentioned in the Rektabittam, can be used, or Mahadiktagam, which is mentioned in the Kushta Prakaranam, or in Tiktagam Kridam, which is mentioned in the Kushta Prakaranam, may be used. See, don't be thinking that the Tiktagam Kridam is mentioned in the Kushta Prakarana. How can we use it in the migraine headache? Look at the Phalasruti of Tiktagam Kashayam or Tiktagam Kridam. It's mentioned that Pitta Kushta Pari Sarpa Pedaga Dahadar Prapan Kandu Panduamayan Gandan Dushtanali Vranabaji Vispodam Vidrati Gunmam Chopam Unmadam Madanabi Pagandaram Abasmana. So it is mentioned in several Shirorogas. So you may have the freedom to use the medicines which is mentioned in the other Prakaranam if you think it is suitable for the roga and for the doshavastha. And when you are going, to the principles of Shiroroga Chikitsa, you might think that, I don't want to follow the Jwara Chikitsa while treating the condition. I want to follow, the Shiroroga Pradesheda Madhyayam. So in the Shiroroga Pradeshedam Adhyayam also, Vakpada says, Kradamakta Shiraratrau Pibed Ushnapayonuvaha. See, so he is mentioning about the indication of Kridam, and Shiram has to be given. But we should understand, when should we give Shiram? Again, the reference is back to Jwaram. It says, Shirojitasya Prakshina Sleshmano Dahatridvadaha Shiram Pittanilarthasya Pathyamapet Adisarinaha. So, when the Kapashaya has achieved and when the condition has become Vada Paitiga in nature, this is the time to give the milk. So, what kind of milk can we give? So, it is mentioned, again, Kasad Shwasad Shirashulat Parshvashulat Chirajwarat Muchyade Juradaha Pitwa Panjamuli Sridambayaha. So, Panjamulam can be boiled together with the milk and it can be given in such condition. Now, what time of the day, we should give the medicines, or references about Aushadha Kalam comes into place. It says, Urthujatru Vigareshu Sopnagale Prashasyade. So, the medicine can be given at the bedtime. And if you want to treat it as Pranavada Dushti, so give it Grasa Grasandayoho Prane Pradushte Madarishvane. So, it can be given during the food intake or between the spoon of food. So, again, the other treatments, Shirovasti, Nasya, Virechana, these are all effective remedies according to the stages. Now, the stage 4, it can be like, you may give Rasayanas like Brahma Rasayana, etc. So, there are several other medicines, which are indicated in the Shiroruk or in the headache context. Say like you take Varanadi kashayam. Varanadi kashayam is Kapham Medo Mandaknitvam Nayachari. It is Kapha Vada Shamana. So, it is mostly useful in the sinus headache or mostly useful in the tension type of headache. Or you may use Indugandham kashayam. It's again, Vata Kapha Shamana in nature. Very effective in the headache related to the sinusitis. You may give Dasmamoola kaduthrayam, which is again Vata Kapha Shamana, effective in sinus headaches. You may give Guguladikthayam kashayam, Kapha Vada Shamanam. You may give it in sinusitis kind of headache. And if you want to treat it, only with external treatments, say like in tension headaches, we give Rasnadi Churnam for Talam. While migraine headaches, in my opinion, maybe Kachuradi might be better than the Rasnadi Churna. So, when you are treating, a condition of a tension headache or a sinus headache, you may go for oils like Asana Eladi Thailam or Asana Vilwadi Thailam are good choices for Shiro Abhyangam in cases of tension headache or in the sinus headaches. While we are treating a migraine condition, which is more of Vada Paitiga in nature, once the Sthani dosha is taken care, which is the Kapha, you may go for oils like Asana Manjishtadi Thailam or Bala Guluchyadi Thailam or Bala Thatriyadi Thailam or Brahmi Kridam. They works better in migraine headaches. And see, you might think that giving medicines, the patient will get 100% cured. I know few of the migraine patients, who are chronic cases, who get upset for not getting the periodical headache, since they are set for that routine of headache, Pakshad Kupyadi Masadva. So once in a month, if they don't get the headache, they don't feel good. So in such cases, Satvavajaya Chikitsa or Deva Vyapasraya Chikitsa are required. And we studied in the Jwara Prakaranam that Jwara Kala Smritim Cha Asya Haribhir Vishayed Hared Karunardram Manashutham Sarvajwara Vinashanam. Maybe you might rewrite it as like Shiroruk Smritim Cha Asya Haribhir Vishayed Hared Karunardram Manashutham Sarva Shiroruk Vinashanam. I think I took almost 47 minutes, Sorry if I went too much into the textual references. And if you have any doubts, please send me a text message. I will be happy to reply you. About the menstrual migraine, of course, the Ardhavabehdaka conditions are very clear there, and especially when it is towards the secretory phase. It is dominance of the pitta dosha is there in the secretory phase. So therefore, sometimes pitta dominance and together with vata will be there. So the principle I have mentioned the same. So lot of drugs of choices I have mentioned which are pitta vata shamana in nature. Thank you so much. Hope to see you with another topic next time. Thank you very much.